Hello, everybody. Welcome to Carroll PMC's 10th meeting of 2021. You may be wondering why I am only speaking to you, and it is because I was put in charge of recording this meeting, and I sort of missed the introduction. Therefore, I am going to share my screen currently and present the introduction that I should have presented to you now. All right, so like I said, this is going to be our 10th meeting of 2021, and we have a really special guest in this meeting. It is Lisa Benzel. She is part of the WWAMI program, which is an excellent program for students in Montana, Wyoming, Idaho, oh goodness, Alaska. I think I got them all. Washington, if I didn't say it. But it's a great opportunity for residents of these states to access resources and different types of scholarships and loan repayment programs in order to apply for, fund, and successfully support the medical school process. Here she is on today to talk about TRUST, the NHSC Loan Repayment Program, and the options that come with that type of method of funding medical school or paying it back. MRPIP and SHPEP programs for pre-medical students who are freshmen and sophomores and are looking to get a better idea of what the medical school process, medical school application process, and medical school process as well is like. So today's agenda is just a few opening messages and the COVID-19 case report as usual. Lisa Benzel will then present, and then we have a few questions. We'll discuss our next meeting, and then we'll have a few closing remarks as well.
Serve track, and it is a longitudinal medical school experience. The goal of TRUST is to increase the number of students who are choosing primary care and going into other rural needed specialties and then returning to practice in those areas in the state. Having said that, just because someone's in TRUST doesn't mean we make you promise your firstborn. If you don't go into a rural or primary care field, we know that when you start, you may have a vision for what you think your medical career is going to look like. And then once you get exposure to different things, you may decide that it's a different path than you had originally planned. So admissions for TRUST is the same as admissions for any other Montana WWAMI student. There's 9 AdCom. Well, first of all, we do it typically in January. We're not in charge of that. UW School of Medicine does assign our week, but for the last 3 or 4 years, it's been in January. We have 9 AdCom members who interview in 3 rooms for 1 work week, or actually Monday through Thursday. Last year was virtual. What they're telling me this next year is that it's also going to be virtual. And I have to admit, I'm really bummed out about that because I love meeting applicants in person and getting to know you, and it just makes it a little more difficult to share information and get to know each other when we're on limited virtual connections. But that's what it sounds like it's going to be for next year. So as far as considerations for TRUST admission, these are not 100%, and you don't even have to have one of these. It's just when they did research to determine who typically goes into a rural primary care field, these are the points that they consider. So a rural and/or disadvantaged background, prior career experience in health-related work, significant volunteer experience in rural or underserved medical settings, a strong commitment to service, Montana Rural High School graduate, and a graduate of a Montana Public College or university. So it's not to say that if you live in Missoula and you went to Brown School and your job shadowing experience has all been with specialists, you can't apply. If you decide that this is what you're interested in, definitely talk to me. I can get you some rural job shadowing experience. And the reason that's kind of important is they will ask you why trust, why are you interested in rural or underserved, and if you've never experienced either living there or the clinic experience, it's going to be tougher for you to answer that. We do admit up to 12 trust students each year, and our class is 30, so that's 12 and 18. So like I said, it's the same application process, it's the same interview process as the regular WWAMI class, with the exception of 4 additional questions in the secondary app. Very simple questions, not trick questions. We're not looking for any specific answer. We just want to know the answers that you have. So describe why you desire to participate in the trust program, which specialty is most interesting to you, and where you would like to practice. So like I said, if while we're looking for primary care, that doesn't necessarily count you out. There's a lot of fields in rural medicine, such as general surgery, orthopedic surgery, what's the other big one that we have? Well, we have family med, internal med, pediatrics, OB-GYN, psychiatry, general, orthosurgery, and ER. So if you're interested in any of those, answer that. And if you think you're interested in oncology, answer that too, because it's not necessarily going to count you out. It depends on what the other pieces are. There's oncologists that go and do rural clinics in rural or underserved areas, so just be true to yourself. Number 2, do you prefer a rural, small city, or you don't care which placement? That's just to help us with your trust continuity community placement. If you want to be in a small city, we try to do our best to place you in one of our small city sites. If you want rural, same thing. And if you don't care, it makes it really easy on us. Identify the rural and underserved areas where you have lived or worked for more than 2 months. That's just, providing information that you understand rural or underserved. If you haven't, then you can refer to your job shadowing experiences. Are there any concerns you have about entering medical school as a trust scholar? It's fine to have a concern. We have many students who have concerns. The biggest one is typically, I'm concerned if I am going to get a well-rounded medical education, if I'm going to, see enough of the oddball situations. And we want to be able to allay those fears, and we can, because you are required to do some of your training in Seattle or another tertiary facility. So in 2008, we started Trust in Montana, and we have now expanded to every WWAMI site throughout the region. These are the 38 sites that we have. I'm only showing you that to show that it is expanded. I guess I could also say I'm showing it to you in case you have any students who have residency in other WWAMI states, because if you do have residency outside of Montana, you can't apply to Montana WWAMI or Montana Trust, but you can apply in the other states. So that is the reason for that. Here are our 11 trust sites, and in Bozeman, our foundation campus. And that's where you spend, of course, the first 1.5 years of your training, and then you do clinical outside of that. We'll go over some of that. We have sites like Polson and Hardin that have some Native American experiences available. We have some sites like Lewistown and Livingston that have surgery opportunities. Dillon has great internal medicine. There's just key points at all of them that are really good, and so that is why we do the assigning of the trust placement sites, taking into consideration everything that trust applicants are interested in, whether it be recreationally, what they're looking for in a preceptor, geographically, etc. So the components of Montana Trust starts with your FSE. We love acronyms, as Andrew might have mentioned in his intro. FSE is First Summer Experience, and it's 10 to 12 days that you start, you go to your site before you pre-matriculate. So you've already done your job shadowing. We don't expect you to do a whole lot more job shadowing, but we do want you to get to know the community that you're going to be spending time in, as well as the preceptor that you're going to be working with. So we do have you go out and do that, but this is mostly a community-based experience because we want you to figure out what the community has to offer, what the facility has to offer, what the area has to offer, like recreation, what can I do in my off time, that sort of thing. And we want people in the facility to start recognizing you so that when you walk down the hall, they'll say, "Hi, Andrew, good to see you back again." And you start feeling like you're part of the family, part of the team. The next time you'll go out to your site will be during one of the intercession weeks. And we, until just recently, called it EHM, and I guess I have to update this slide, but it was Ecology of Health Medicine. Now it's TIM, which is Themes in Medicine. Same basic difference. You would do some online homework and classes, but for the most part, you're there to do clinical experiences. You'd be there for 1 week, 3 different times throughout your first 2 years during the foundations phase. RUOP is another opportunity to return. RUOP is Rural Underserved Opportunities Program. It's a 4-week elective immersion experience, and you get to do a lot of clinical stuff. By this point, it's in the summer between your first and second year. At this point, you've done a lot of patient interviews, you've done H&Ps and physical exams, and you've taken vital signs, and you know more than what you did at your FSE. So you are knee-deep in patient care. It's a great experience, and it actually is one of the highest ranked opportunities for students in the WWAMI program. Right is 5 to 6 months, depending upon where you're at and what they have to offer. 5 to 6 months of clerkship training and a longitudinal experience. So you're there. You have your own patient panel. You will go in, you'll visit with a patient, you will come out, you'll report to your preceptor, you'll discuss what you think the diagnosis or situation may be, you'll come up with a plan, you both go back in, talk to the patient, and then you'll tell them, return in 2 weeks or 4 weeks or whatever, and then it's basically your patient. And so you get that continuity experience as well. Typically in a right situation, you'll spend some time with a family med doc, a couple days a week. You might get to do an evening or a weekend shift in the ER. Depending upon what you're interested in, you can do a little more or a little less. In some of these areas, you get to see peds patients, geriatrics patients, spend some time in surgery if you're interested. So they typically set your schedule up so that every Monday, Tuesday, you're in family medicine clinic. That way you can have your patients return on those days. After that, you will go out to Seattle typically, although they may end up sending you, depending upon scheduling, to Boise or Anchorage or Spokane, something like that. You will do 3 weeks of inpatient peds, 3 weeks of inpatient psych, and 6 weeks of inpatient internal medicine. And then you have opportunities to go elsewhere. You can also do rural clerkships in the state of Montana. If you're interested in rural OB or rural general surgery, you can do those. Not always at your very own site, but you can do it in the state if you want. They also have a 4-week experience, usually in the 4th year, called advanced patient care, where you come back and you're at an even more advanced level than the right situation, and you can do that at your own site as well. The other thing we like to encourage in our trust scholars is leadership. And part of that is because we figure if students are going to return to their rural areas, they'll find that if students return as physicians, they will find that they're kind of leaders in the community. You know, doctors just kind of tend to have that. So we want to give some opportunity for you to learn things like advocacy or how to lead a meeting, stuff like that. So we do a leadership retreat that happens in the summer between your 1st and 2nd year, excuse me, and happens again in the summer between your 2nd and 3rd year. Both classes come together. It's fun. We do it. The last few years, we've done it at Homestake Pass Lodge. Before that, when it was earlier in the spring, it was the end of May, we did it at Flathead, one of the Flathead Valley Bible camps. So, and then we do all expense paid trips to national, regional, local, and occasionally international rural and underserved conferences. So some of them might be the National Rural Health Association, the AAFP, or the AAP, which is the pediatrics, or the MMA here in Montana, or the Montana Psychiatry Conference. There's just all sorts of them, and we encourage attendance, and we also encourage student leadership positions when they're available. Hopefully someday we'll go back to traveling where we can do those in person. Right now they're all happening virtually. So there's approximately 25 to 35 trust applicants a year, and approximately 22 to 30 of those interview each year. If you don't apply for trust because you don't understand it, don't think it's for you, think you grew up in a rural area so you know everything there is to know about rural, and then you change your mind, you can do so. Just contact me and I can get your application reopened. You can, if you apply, you can withdraw your trust application until Thursday at noon of interview week. And why would you do that? Well, maybe you learn something in the interview that makes you think, oh, maybe this isn't the best thing for me, or maybe something's changed since you applied. You know, some of the other options outside of trust, well, doing the non-trust option, is you can do right with trust. You can do Safari, which WWAMI Safari is just where you kind of live out of your car for 4 to 6, or for 2 years, for 4 to 6 weeks at a time, where you know, go to Billings and you might do surgery. And then you're in Boise doing OB, and then you pack up your car and you head to Spokane for neuro. Some students like that. It's exciting, adventurous, that sort of thing. Others that maybe have a spouse or a kid or something like that decide they want to do a track and stay put for the better portion of their last 2 years. The tracks are available in the state of Montana in Missoula, Billings, and Bozeman. you can try to get into a track in another state, and if the other states always get first opportunity, just like Montana students get first opportunity in our track sites, but if there are open slots, you can apply for those. So you may be in a situation where you're married and you end up finding out you're pregnant. And so you don't want to do the right situation or the trust situation where you're doing right here and then you go to Seattle and then you come back, and maybe you just want to sit at a track site. You know, those are some of the reasons you may decide, okay, I thought trust was best, but now situation has changed. I think I want to step back. So you can withdraw your trust application. However, once an offer is made to the trust class, you can't move into the regular trust class. So you need to decide by Thursday if you want to be considered for trust or non-trust. If you withdraw, it does not hurt your chances of getting into the regular WWAMI class. We want everyone to make the best decision for them. And if the best decision is to be non-trust, we strongly encourage you to do that. If you're offered a spot in the regular class, but you're a trust applicant and you end up on the alternate trust list, you could be later offered a trust spot if one of the trust offered folks decide to go elsewhere. So, and you don't have to take it at that point. It's offered to you, you make a decision. So those are just some things I like to point out. And then once you finish trust, you go into residency. We try to help you get set up with a residency that focuses on rural, if that's what you're interested in. And we try to help you get into practice in rural or underserved areas and help you with the loan repayment information, which I will discuss next, either the MRPIP program or the National Health Service Corps programs. So I don't know how you prefer I do this, Andrew, if you just prefer I go through the whole presentation and then go back for questions, or do you have a preference?
I think that sounds fine to me to just continue on. So long as you are okay with being interrupted, if that's okay, then
Yep.
shout out any questions you have throughout this. Otherwise, yeah, Lisa, I think you could just go straight through it.
Okay. Yeah, feel free to interrupt me if anyone has questions. So next is MRPIP, Montana Rural Physician Incentive Program. This is for MDs and DOs only. And so if you are interested in some other healthcare profession, this won't be applicable to you, but I'll make it snappy. So this was started by the Montana legislature and is really a great program. Students, Montana WWAMI students pay into it, and then when you return and you work in a rural or underserved area, you can get loan repayment, which is funded through the MRPIP funding fees. So it's just created to encourage physicians to return and provide services to those rural or underserved areas. And applicants in the associated facilities must establish that a physician shortage exists and the area has been unsuccessful in recruiting. And that's pretty easy to do. Eligible MRPIP applicants, you either have to be an MD or a DEO or a DO, obtain licensure in the state of Montana, have existing medical education loans held by U.S. lenders or U.S. loan servicing agencies. That's very important because if you get a loan from a family member or something like that, you cannot use Mr. PIP to pay them back. It has to be an eligible loan servicing agency. You have to have full hospital privileges in the community in which you practice, and we ask that you apply for the NHSC loan or scholarship, well, it'd be loan, I guess, at this point, benefits first. And the reason for that is twofold. One, it's going to pay you a little bit more in a faster way. You'll get $150,000 over 2 years. And with Mr. PIP, it's 150, but it's spread out over 5 years. You can reapply for the NHSC programs after the 2 years, so you can do 2 and then 2, and so it just pays off your loans quicker. The other reason is it allows us, for those sites that don't qualify for NHSC, we can give use our money for more people that don't qualify and pay off more loans and provide more assistance to more providers. So, and then once you're done with the NHSC commitment, if there's any remaining loans, then you can apply for Mr. PIP, or you don't even have to, you've already applied, then you can get Mr. PIP. So Mr. PIP is paid in a graduated payment schedule. You can see the schedule here. It starts out at $10,000 every 6 months for the first year, and then it goes up to 12.5, up to 15, etc. And so $150,000 is paid over a period of 5 years. In 2018, the legislature made some changes, and once a student is accepted into the WWAMI program, you need to decide, you have to sign on to a contract, and you need to decide whether you want to return to Montana, commit to returning for a period of 3 years, or if you don't want to commit, then you pay a little bit more. You have to return within 1 year of finishing your residency, and that's only granted if you're doing a fellowship like an OB or a sports medicine or something like that. You can't just take a year to work somewhere else. So these are the two options. There's the payback option and the clawback option. The payback option is like it always has been. You pay, and these amounts change a little bit each year. They increase just a smidge, but you pay $5,400 a year, and you promise to return to the state with no penalty and the opportunity to receive the $150,000 if you return to a rural or underserved area. The clawback option is what we suggest students do if you're not 110% sure that you are going to return to a rural or underserved area. And we had a student that he opted to go the payback option. He was a single guy and he wanted to return to Montana, and he was afraid that he would meet someone along the way and she wouldn't want to return. And so he said, I am going to commit 110%. And that way, if I meet someone, I can say, I have to return. There's no way around it because I don't want to pay the penalties. But we always encourage everyone, if you're not totally committed, that you go with the clawback option. The clawback option, you pay 2.5 times that much, so it's about $13,500. You don't have to return, however, you can return. And if you do return and work in a rural or underserved area, you can still qualify for the $150,000 repayment.
Did he meet someone?
He did. And guess what? She's returning. She is a Southern California girl because he went to school in yeah, I'm going to draw a blank on the name. It'll come to me as I'm presenting here, but they had a lot of fires there last year. And anyway, they got married, and she's actually finishing her dermatology residency in Salt Lake. And so he works part-time in person. COVID has been really good for them for this reason, but part-time in person and part-time in virtual. And so he'll be in Hardin part-time, and then he's in Salt Lake seeing patients virtually part-time. And then when she's done, they're going to move to the Hardin Billings area. He will practice at the Bighorn Community Health Center, which was his trust site, believe it or not. And she will practice dermatology between Billings and Hardin. So yeah, it kind of worked out for him. Okay, so if you have any questions about residency in the state of Montana, Lori Tobel is your contact person. She knows all of the answers. She's the one that approves residency, and yeah, she's great. So next we're going to talk about the NHSC programs, which is the National Health Service Corps. The programs we'll discuss are Student to Service, Rural Community Loan Repayment, NHSC Loan Repayment, and NHSC Scholarship Programs. So first is loan repayment. The qualifying careers are physician, either MD or DO, advanced practitioners like PA, NP, certified nurse midwife, behavioral health professionals, dental professionals, and pharmacists. So, and you have to work in urban, rural, or tribal communities, and it's based on HPSA scores. HPSA is Health Profession Shortage Area. The higher the score, the higher the need. And so if you look at this table, sites with HPSA scores of 14 to 26, you can get, if you commit to full-time work, which is 40 hours minimum, you get up to $50,000. And if it's part-time, 25. If the HPSA scores are lower, you get 30 and 15. I have to tell you, I have been working with the NHSC for probably 25 years, and I have never seen them pay out below a 14. So you pretty much have to go to the high need areas. I would say most scores that pay out are in the 15 to 20 range. The rural community loan is a fairly new one, and this supports clinicians working to combat the opioid epidemic, and so anyone working in substance abuse disorder treatments, recovery, those sorts of things. If you do 3 years of full-time, again, full-time is 40 plus hours, part-time is 20 to 39, you get up to 100,000 over the 3 years, and part-time is 50,000. You can see there's physicians, the advanced level practitioners, behavioral health professionals, nurses also fall under this one, as well as substance use disorder counselors and CRNAs. The scholarship program is a little different than the loan repayment options. So the scholarship program, at any point in time after you start medical school, you can commit to be an NHSC scholar. And for every year of financial assistance, you have to commit to 1 year of commitment with a 2-year minimum. So if you sign up in your 4th year, you still have to commit to 2 years. The difference between loan repayment and scholarship is with loan repayment, you graduate with loans and they help you pay them off. With the scholarship program, you don't have much, if any, loans, and you owe them time. The scholarship assistance covers tuition, fees, educational costs, all that is tax-free for up to 4 years, and then they give you a monthly taxable living stipend. So that's the one piece of the NHSC that is taxable, is that stipend. You can see the areas that are covered for this one. And then last is the Student to Service program, and this one is the one that is, at this point in time anyway, easiest to get. It's probably been in place for maybe 8 years, but there just aren't that many people that use it. So everyone that I know that has applied has gotten it. So you enroll when you're a student in your final year of med school, and then you receive loan repayment assistance during your residency of $40,000 a year. And in return, you have to return to a high need area. It's MDs or DOs, but you have to be general type physicians. You can't be, even if you're going to work in a high need area, you can't be a orthopedic surgeon. You have to be general. Same thing, general type dental practitioners, nurse practitioner, and certified nurse midwives can also qualify. Okay, and I will send all of these links to Andrew and he can distribute them to you. When I do this in person, I have these handouts, but because we're not in person, I will give you these links and then you can go out and get more in-depth information, because I just did the 30,000 foot level there. Things to remember is they only pay qualifying student loans. You can reapply after your first commitment is met, so you can do 2 years, 4 years, 6 years, etc., until your loans are paid off if you're happy with where you're at. It's non-taxable, other than, of course, that living stipend. You must return to a HPSA qualified community. And awards are determined based on disadvantaged backgrounds and likelihood to remain in a HPSA area. So if you grew up in a rural, low income, disadvantaged area, are a first generation college person in your family, you're highly likely to get this, because those are the sorts of things that they look at. So next we're going to go on to how to determine HPSA scores. And you can go to this hpsafind.hrsa.gov, and it's kind of complicated, so I just go through it really quickly. You select your state, appropriate counties, and then the filters. So you can see here, I selected Montana, and then I selected just Beaverhead County, and if you do control and click, you can select more than one. So I did Beaverhead County and Choteau County. And then if you're a physician, you would probably do primary care, maybe mental health. If you're a dentist, you do dental health, psychiatry, behavioral health, those sorts of things, you do mental health. And then you always want to do designated, because you want the communities that are already designated as a HPSA area. There's all these other filters if you're interested in some sort of a federally qualified health center or Native American Indian health experience. You can use those, but most people don't. And then the HPSA score ruler, you can slide the ruler depending upon what your commitment is. Scholar recipients are usually 17 and higher, and then loan repayment and student to service, those sorts are usually 14 and higher. And then the last one is the Summer Health Professions Education Program. I'm going to go through this quickly. This is, it's called SHPEP, and I don't know if they have a way to say that. Let me get out of this, and I am going to go to this, whoops, go to this one. So because of COVID, everything is virtual, but this is going to take place from June 21st to July 30th. It's always 6 weeks. It's a little different because you're not in person, so they're doing it for shorter time periods each day, but it is sponsored by the School of Medicine, the School of Public Health, and the School of Dentistry at UW. The goals are to strengthen the academic proficiency and career development of students underrepresented in the health professions and prepare students for successful application and matriculation to health profession schools. This covers like pharmacy and I think social work and dentist and medical school and PA and NP. So it covers a lot of them. And if you are any disadvantaged population or low income, those sorts of things, it covers all of that. Eligibility is US citizenship or a permanent resident or have DACA status. You have to be a first year or second year at the time of application. Minimum GPA of 2.5, can't have participated previously, and if you did participate in Running Start, you should apply. These are the 12 program sites that are involved, and that website that you see up there at the top is where you can find more information. University of Washington is one of the 12. You can apply for, I think they have you apply for 3, and so you can apply for any of these. So there's 8, here's the 8 health professions: dental, medicine, nursing, optometry, pharmacy, physical therapy, physician assistant, and public health. This is the catchment by region, but again, you don't have to go to Seattle if you have a different preference. You can certainly apply for somewhere else. All sites are virtual this year. You apply to 3 sites. The start of the program, this is one reason that UW might be a good place to apply, because if you apply to something on the East Coast, your mornings are going to start very early. But you know, we can all get out of bed, so we're not going to worry about that. Some of them start earlier, and so you need to make sure that you're out of school if you're interested in applying for that. They give you a $600 stipend plus $100 per week for food allowance, which maybe because you're doing it virtually, they think you'll order in. I'm not sure why the food allowance, but anyway, $1,200 total. And they take about, at UW, about 40 med students, 20 dental students, and 20 public health. Those are the only fields offered at UW. That's why you may want to apply elsewhere if you're not in one of those. So this is a sample weekly schedule, and you can see that there's lots of different things, including like bonding activities, and there's study guides and wellness. So there's a lot of different areas there, and they change each week to a certain extent. I don't think you have to do the study hall on Sunday, but you have to be there for everything else. There's classes, wellness, pathways, informational interviews, and virtual hands-on activities. Hands-on activities include things like dental simulation, nursing simulation, medical laboratory sciences. Community building activities, chit chats, cooking competitions, talent show. And so then they do a personal statement guideline. So what you want to consider when you are applying, because you do have to do a personal statement. It's a great lead in to doing a personal statement for whatever you're applying to. 600 words maximum, so it's approximately 1 page, and you just cover things that like personal background, interest, experiences that have influenced your decision to pursue a career in healthcare. You apply at shpep.org, you submit a letter of recommendation, transcripts, and complete an essay. It opens, I mean, we're already past it for this year, so next year there will be new dates, but I'm assuming it's going to be pretty close to November 1st to February 5th. And Nora Coronado is the person who knows everything about this, and she's the one that asked me to share information because they're really trying to bump up their regional participation. And so if you are interested or you know anyone who might be interested, please share this information with them. So, oh, and it's funded by Robert Wood Johnson. And I guess that's it. So then I am going to go back to this one just to put up my contact information if you have any questions. Let's get to questions because I think I went a little over.
Oh, that's great. That's so much information, but it's all very helpful because I know a lot of people are considering, well, how are you going to pay for medical school? And also some of the opportunities that lay in our path currently and also in the future. So thank you for presenting on all of that. And yeah, like good. And now it's time for questions. We have about 7 minutes left of normal meeting time, but I'm sure you can contact her with information on this slide in the future as well. But any last minute questions anybody has?
So I'm not a Montana resident, I'm an Idaho resident, and I'm super interested in trust. How similar is the Montana program to the Idaho program?
Very similar. Like I said, we started it in Montana, but the dean that started it in Idaho copied us and continues to copy us. She contacts me all the time saying, how do you do this? How should we do that? And so it's very similar. You're going to have different sites, but even the preceptors have the same way that they run the program at their site. So if you want to be connected to anyone in Idaho, let me know. I'd be happy to introduce you.
Awesome, thank you.
Mm-hmm.
Can you switch between states? Like if you're from Montana, can you switch over to Idaho or any of the other WWAMI states?
You can't, and it's because it's based on residency. And so, you know, like in Montana, Lori Tobel is the one who says, yes, you meet the residency requirements, and there's somebody in Washington or Idaho, et cetera, that do the same thing. So now, if I say, no, you can't, there's probably always a way around it. Like we had a student way back in 2008, if I remember right, and her fiance was from Idaho, and they didn't have trust in Idaho at that point, but they did allow her to switch and be an Idaho WWAMI. And I don't know how she made that happen, but they did allow it. So the answer is no, but maybe, if that helps at all.
Thank you.
But if you're really interested in something like that, I can connect you with someone in the other state to see if it's possible.
I think we
What
got.
is some of the common feedback you hear from trust students on the program?
Pardon me?
What is some of the common feedback you hear from trust students about the program?
Oh, we have not had anyone who has not loved it, thankfully. I mean, we want to hear if they don't love it, but it's been great experiences. So if you think about doing a safari, you know, if you're doing 4 weeks here and 6 weeks there, you're going in and it takes you at least a week to kind of get integrated into the facility for your preceptor to figure out what your skill level is. And so with trust students, they hit the ground running. Every time they return, their preceptor has already met them. They either met them at their FSE or during the intercession clinical visits or RUAP. And so every time they return, it's like they hit the ground running. And I've had RUAP students, which is, you know, between your first and second year, delivering babies, you know, catching the baby, doing a C-section. I've had third year first assisting in surgeries, stuff that you would not have happen probably anywhere else, simply because they know you. And the other thing is, when they apply for residencies, when they go for the residency interviews, it's one of the most asked questions. They said, I've had several people say the whole interview was, well, what's this rate like? And how did you like, you know, returning to the same area? And, you know, they want to hear all about the continuity aspect of it. So, yeah, we really haven't had any trust students. And the other thing is, when we place them at a site, we place them, they don't choose for themselves, although we do kind of ask their feedback. They have always said, this is the perfect fit for me. And so that's always nice to hear too, which is partly because every trust site we have is an excellent site. So. And when I do this in person, I usually try to have a trust student come with me, but our students are so overwhelmed by Zoom and commitments with COVID that I don't even bother them for the virtual. So I'm sorry I didn't have one of them on.
I imagine too, there's a lot of, at least a little bit of extra work alongside medical school as well as being a part of the trust program. But I mean, the way that you spoke about the one gentleman we spoke about, the example of who decided to come back to Montana and decided on the one method of loan repayment in order to do that. It sounds like you're really close to applicants. Is that true? And is that support system, does that support system exist throughout the entire process in medical school and after as well?
It does. I am really close with them. They're almost like my own kids. Oren or Dr. Hansen is the one I was telling you about, and I was invited to his wedding. I am a godmother to one of the trust students' kids. So yeah, I mean, we stay in contact, and the assistance does continue. I'm meeting tomorrow with a student who is in her third year of residency, and well, almost third year. And she wants to return to Montana, so she wants to sit down and talk about what the possibilities are and start the recruitment process. And my life before being a trust director, I was a rural physician recruiter, or maybe healthcare provider, or healthcare recruiter is the better way, because I also did nursing and PT and whatever for the Montana Hospital Association. And so it just kind of rolled over that when I went into this role, my boss said, and we can help you with finding placements when you're ready to return to Montana. So I do that. We've had, Oren went to Hanson, we've had a doc go to Polson. We have 2 of our Miles City Trust students. No, one of them's Miles City, one of them's Hardin. They're both returning to Miles City this fall. We had another, one of the very first trust students is working in Miles City. We've had, where else have they gone? Libby. So they do return to either their trust site or another trust site, and they do return to rural areas. And that's what our goal was. So we're really excited. We're finally starting to see the results of that long pipeline.
That's great to hear. And with that, we are about at 8:30, and so we're going to switch back to our PowerPoint. But Lisa, thank you so much. This has been great. So much information. This will be accessible via recording for our members who couldn't make it today. But really, we appreciate your time, and thank you so much for presenting today.
Great. Well, holler if anyone needs anything. Thank you very much. Take care.
Thank you, Lisa.
Bye-bye.
All right, guys, I'm going to share my screen again, and we will get this presentation wrapped up. So our next meeting is to be defined at this point. We're going over a couple of ideas. However, I believe that we will try and meet in person for this one and do something a little more hands-on. I think that would be a better way to, I don't know, get involved and get hands-on again. It's been a while. And we went through questions already. So with that, Michael, our parting message.
All right. So this week's quote is: "Strength doesn't come from what you can do. It comes from overcoming the things you once thought you couldn't."
Cool. All right. Well, have a great weekend. Everybody sanitize your laptops, and we will see you guys next week.